everyone, my name is Courtney Finest, and for my neurological condition, I will be discussing the topic of fibromyalgia. Prior to me starting this video, you should have received 2 ice cubes in a little Ziploc baggie. If you would like to participate, please take those ice cubes out of the bag and place one in each hand. Hold that for as long as you can, even throughout the duration of this presentation. If it starts to feel too painful, feel free to put those back in the Ziploc baggie. But the goal of this is, as I'm discussing fibromyalgia, you'll really get a sense of what this may feel like to some patients. So to begin, what exactly is fibromyalgia? How do people describe it? And author Choi, in his article, Fibromyalgia Syndrome, identifies fibromyalgia as just being pretty much widespread pain through all 4 quadrants of the body, including the axial region. Fibromyalgia can sometimes feel like pin needles, numbness, tingling feelings, just different sensory sensations throughout your body. It is also characterized by swelling, restless sleep, fatigue, all those things that may go into pain and decreasing somebody's tolerance. The etiology, what exactly causes fibromyalgia? In the Townsend Letters, author Teitelbaum says that there's really not a known for sure etiology. There are some things that we think may contribute to it, but fibromyalgia is still something that researchers are discovering to find a really set cause. But some of the things that may contribute are different infections, nutritional deficiencies, such as maybe not getting enough nutrition in your diet. Disrupted sleep is a huge one. Pregnancy, your risks do kind of increase during pregnancy. Hormonal deficiencies, stress, and also injury. Injury is a big one, specifically to the brain and neck region. All these things contribute to fibromyalgia, and we're speculating that they may be some causes. The pathophysiology. What exactly does fibromyalgia impact? Where is it? In Choi's letter, Fibromyalgia Syndrome, fibromyalgia is characterized by abnormalities within your inner brain. This is through the parainsular cortex, the cerebellum, amygdala, and the rostral and cingulate cortex, or the RAAC. These are all in your inner brain structures, and Choi speculates that these are just due to these brain structures maybe malfunctioning. Prevalence, something else that researchers are really still working on. In Wolf, Perrow, Wallet, Rasker, and Hauser, in the Public Library of Science 1, writes that the prevalence is anywhere between 0.4% to even 11%. There's a very widespread range there for how often fibromyalgia actually does occur. Populations and lifespan considerations. Who is most at risk for fibromyalgia? We write that population fibromyalgia can impact all ages, from young to old. However, fibromyalgia does kind of peak right around your middle ages, and once you hit that middle age period, it continues to rise. Your chances increase. We also know that women are 2 times more likely to face fibromyalgia than men. Lifespan considerations. What do people need to look into when facing fibromyalgia? Overall, occupational therapists are very adept at understanding what quality of life is, and fibromyalgia is shown to decrease your quality of life. You're 2 times likely to be hospitalized, 3 times as likely to have major depression, and going along this, we also see patients with fibromyalgia have higher rates of suicide and injury, and also higher rates of rheumatic conditions. Those rheumatic conditions are just conditions related to your joints. All this information we receive from the Centers for Disease and Prevention. Other related disorders. These disorders are usually characterized similarly in terms of fibromyalgia just due to the pain, the location, the redness, and the swelling that can come with it. So the first one is hypothyroidism, where your thyroid is just producing different hormones that may impact different areas of your body. We also see Lyme disease, polymyalgia rheumatica, lupus, and also adult growth hormone deficiency. You'll notice some of these are skin conditions, some of them are more joint conditions, but they're all related because of the similar symptoms to fibromyalgia. And this information we received from author Mandel and the common conditions that mimic fibromyalgia from News Medical Life Sciences. Risk factors. What are some of the factors that may increase your risk for fibromyalgia? This information comes from the International Journal of Rheumatic Diseases, And we see that those traumatic events will increase your risk for fibromyalgia. Traumatic events can be things that happen throughout your lifespan in terms of childhood, but these traumatic events can also be things such as car accidents. We've already discussed that brain and neck injuries can contribute to fibromyalgia, so these traumatic events may contribute. We also see that illness, family history is huge in terms of your risk factor, obesity and smoking. All these risk factors that may decrease someone's quality of life also may increase your chances for fibromyalgia. Okay, so we now know what fibromyalgia is. We know some of the common characteristics. How do we as a medical team manage this? One of the first ways is through non-pharmacological treatment, meaning doesn't really require much medicine. We look at therapy. Physical therapists will address fibromyalgia through education, tolerance training, really narrowing down on that pain. And they also treat fibromyalgia through stress management and actually setting realistic goals of what we can expect that pain level to be at and how we go about adapting. Another way is psychologists teach and monitor fibromyalgia through the psychology flexibility model. And this is all about setting realistic goals and adapting your values to fibromyalgia and maintaining your personality through it all. Another way we see is homeopathy. These are like our natural remedies. And then we also see dietary alterations, maybe adjusting something in your diet that may help to mediate that pain. We also use pharmacological measures in terms of our medical management. First ones being our analgesics and antiepileptics, which are really toned down at modulating your pain receptors, making pain not as prevalent. We also see antidepressants. Earlier we discussed that sometimes depression can come with fibromyalgia, so this helps to narrow that down a little bit. And then we also have sleep modifiers. With fibromyalgia, sometimes sleep is disrupted, so this will ensure everybody is getting a nice, well-rounded sleep. And again, this comes from Choi's level in fibromyalgia syndrome. Some different condition-related precautions that medical professionals need to be aware of when addressing fibromyalgia. First one being is patients with fibromyalgia are extremely hypersensitive to external stimuli. So we have to be care of maybe loud noises, bright lights, visual sensory. They're going to be more sensitive to that, meaning the pain may spike if something's outside of that normal. Another one is intolerance to cold. When it tends to get a little chillier, that pain will drastically increase. So we need to make sure that the temperature is all set for those with fibromyalgia. Another one is rapid changes in medication. Patients with fibromyalgia are extremely sensitive to anything they ingest, so that's something we need to consider. Another one is an abrupt sleeping environment, ensuring that sleeping environment is comfortable, relaxing, able to receive that full night of sleep. And the last one is rapid movement. With that pain being how it is, anything that startles the body too soon will cause that increase in pain. And this comes from Horowitz-Ledger in Fibromyalgia. These are my references for the duration of this presentation. However, I do have some activities for the class to do. So at this time, if you'd like to participate, please get out a sheet of paper and a pen. This further activity is going to come from Cerulli's idea of 10 ways to somewhat understand how it feels to live with fibromyalgia. So once you have that sheet of paper out, write down all your daily activities that you plan to do tomorrow. Whether it's your morning routine, are you going to work? Are you going to school? Do you have practice? Write down that entire routine on that sheet of paper, and you can take a moment to do so. Okay, and from that sheet of paper, now select 4 things. Just the 4 most important things that you have to do tomorrow. Again, personally, I have to hang out with friends tomorrow. I have to go to school. I have to go to my classes. I need to brush my teeth tomorrow, and I need to shower tomorrow. Those are my 4 things. But you'll realize I didn't select everything. Tomorrow I also have to get dressed. Tomorrow I also have to drive. When we're limited like that, selecting those 4 things out of the entirety of what our day holds, we can begin to grasp what someone with fibromyalgia may feel like, the choices they do have to make. With their tolerance to pain, they do have to make those choices on what their body can go throughout the day. So it's really important as us, as medical professionals, to be careful of how much we may be extenuating these patients to if we're performing therapy. if we are in a nursing home and we're treating these patients, how much can their body tolerate in that moment? They may not be able to do everything they want to throughout that day. They may have to choose just those 4 things. So it's something to keep in mind. And the last one involves everybody to stand up. Stand up, get going. We are going to be doing some yoga. I got these further yoga poses from Charlot's website, Yoga for Spring on Kids Yoga Stories. Yoga is one of the ways that therapists can sometimes treat fibromyalgia, get those bodies moving. So the first one, they're really basic. We are going to lift our arms up really high and just be like a sun. Once you have that, raise one of your knees up, or one of your legs, to rest on your knee in a tree pose. The following one, we are going to rest, put our pressure on one leg and move this leg back, and along with our arms, we're going to be like a bird. Okay, that is the duration of my presentation. I hope you learned a little bit more about fibromyalgia and its place in the medical world. Thank you so much for listening, and I hope you all have a great day. Bye.